how is COVID affecting antibiotic resistance? And one of the attendees wanted to know, they thought that the studies of COVID-19 deaths have found that the number of cases with bacterial infections is very, very low. So are we, on the one hand, I think one study found that 70% of patients in New York were getting antibiotics early on. So are we using them, and then is it helping in some way?
So that's a great question. And the short answer is we don't have the data, partly because we haven't collected it. There is some data that has come from China. There's some data that has come from Italy that has shown that there are cases of antimicrobial resistance. But you have to remember that the time scale of two things are different. If we are giving a lot of antibiotics right now, it is likely that we'll see the effect of that much later. And the reason we know that is that the SARS epidemic of early 2000s, in places where excessive antibiotics were used in East Asia, particularly in eastern part of China and Hong Kong, became places where antibiotic resistance really rose up over time. So part of the challenge, and I think the reason we don't pay attention to it is because the so-called tsunami of antimicrobial resistance is on the slower side than how sort of governments take action. And that's the tragedy of it, because it really reaches the point when you can't do anything anymore. But because it doesn't happen on as fast a level, then it really sort of starts to make things very difficult on that front. In the laboratories, on an individual level, yeah, there may be I would say resistance that develops pretty fast, but at a population level, it tends to be much slower, and that's why we don't prioritize it as much. The question about COVID is an important one because, of course, people want to avoid any infections, and there's a lot of prophylactic antibiotics that are given. But I really have a lot of concerns about what might be happening in due course. We do have some data saying that antimicrobial resistance is sort of hasn't decreased by any means that you wouldn't expect, but it might also be increasing, as I mentioned, in Italy. But we do also have data from countries that where you can buy antibiotics off sort of over the counter, that there is an increase in some cases of the use of antibiotics, which means that in due course, those antibiotics will become ineffective, and hence you will have sort of a serious problem there.